CXL X-ray. As Professor Cynthia Roberts already mentioned that the definition of post-LVC ectasia is simply a biomechanical failure that occurs in the cornea. Why this occurs? Because it might be because pre-existing ectasia susceptibility, tissue removal, or flap cut, or maybe post-operative like crabbing and steep pattern and steep apnea syndrome and stuff like this. Let's start with the post-PRK ectasia. How many of you have seen a case of post-PRK ectasia? A few people saw cases of post-PRK ectasia. In literature, there's about 60 cases reported, but this doesn't represent the true incidence, just the tip of an iceberg. And one of the interesting cases showed that ectasia can occur after 16 years of the initial procedure. So long-term follow-up is important, and we see how. How many of you have seen a post-LASIK ectasia?
It's here.
Everyone saw post-LASIK ectasia. Literature is about 1,500 cases of ectasia reported, but again, this is just the tip of an iceberg. I have seen like 500 myself, at least. This is an example of a case that this is not uncommon to have a case like this with very mild myopia and astigmatism, and you can see that the preoperative tomography shows nothing, very, very minimal abnormality. Topometric disease is normal, and the bad D just some yellows, but the final D is good. And after the operation, after 2 years, the patient developed ectasia. We had this publication last year. We published this case with Renato Amoroso in Brazil. Assessment of the preoperative risk factors for post-LASIK ectasia development. We included a lot of risk factors, topometric, topographic parameters, include subjective curvature pattern, topometric elevations, bathymetric indices, BAD, intercameral lab force index, and preoperative ectasia scoring system, the PTAs, Randleman scoring systems, and the Navarro index. And we concluded that the current ectasia risk assessment criteria based on topography or tomography were insufficient for detecting relatively large number of cases, and this is an equal need for information from multimodal imaging like with biomechanical assessment and thickness map, epithelial thickness map. What about the post-ectasia, post-smile ectasia? How many of you have seen cases of post-smile ectasia? Okay, there are a lot of biomechanical studies showing that smile might have some privilege over the other procedures, and this gives you a false sensation of security, because if you see cases like this, you think that smile might be appropriate in these cases, the borderline cases. And I did this tables myself. I compared the tissue removal in the smile and with excimer laser, and as you can see that with the smile, and sometimes it's 37% more tissue removal if compared to excimer laser. And this was a publication from Germany comparing the changes in the corneal volume and corneal thickness after myopia correction between LASIK and smile, and showed that there is more tissue removal with the smile for the same diopteric correction. I was lucky to present the first case, or reported the first case of ectasia worldwide with bilateral ectasia after smile. This was in April 2015. A case came to us with mild myopic astigmatism showing some abnormality in the posterior surface and with thinning of the cornea. We asked the patient not to do any refractive surgery, but because of the studies of biomechanical privilege, he did smile elsewhere and he came to us with ectasia. This was published in the Journal of Cataract Refractive Surgery and was featured in the editorial here. And we thought it's just one case, but a month later there is another case report for ectasia after smile. September 2015, another case. July 2016, it was featured in the editorial. I like this name, ectasia after corneal refractive surgery, nothing to smile about, with Bradley Randleman. April 2017, another case, another case, another case of ectasia after smile, another case of ectasia after smile. And Dr. Mai mentions LOX enzyme, and it's important rule in pathogenesis of keratoconus, the OHT group found reduced in cases of ectasia after smile. This is very important. Another case of ectasia is mentioned here because of what we are going to say later on. Ectasia after smile without risk factors is not a borderline case. As you can see, the preoperative values are normal and ectasia occurred afterwards. Another case interesting was a preoperative biomechanics even. You can see the biomechanics are abnormal here, the CBI and TBI, and the D value is high, but the topometric values were perfect, so the patient underwent smile and developed ectasia afterwards. Why it occurs after a smile? We knew that the vertical cut is important in affecting the biomechanics, but there is a vertical side cuts in the smile to release the venticule. Empty space might be a trigger to let the posterior stroma bulge. Eye rubbing might be the reason. And then abracadabra, Greek logician John Canablis had a nice idea, brilliant idea, prophylactic cross-linking. This is why I'm doing my presentation today, because of the prophylactic CXL concept. The LVC extra is a simultaneous accelerated cross-linking combined with refractive surgery. It is done for borderline cases, and the definition of borderline cases actually is very broad. But the question is it effective? Reported complication like K's, DLK, and CTK already reported in literature. Let's have a look on a case of PRK extra. This is a case referred for me from Jordan, and you can see that the PRK extra epithelial debridement, and you do your laser, and then you put your riboflavins. There are different concentration. I was already discussing it with Osram Mazota that have different concentration of riboflavins that you can use in cross-linking with different exposure times, with different energy, with different total energy. There's no fixed protocol for this, and you can see that this patient, after doing PRK extra in Amman, and now he's suffering from post-PRK extra ectasia. So it was not effective, the procedure. And you can see the difference on axial map, and you can see the difference on posterior elevation map. What about basic extra? You create the flap, you put the riboflavin, you do irrigation, and then you replace the flap and do ultraviolet through the flap. The epithelium, of course, will absorb some light, and the oxygen penetration to the stroma will be affected. Just 1 minute. This is the steps of the operation, and this is a study showing the biomechanical changes with Scarcelli and Bradley Randleman, showing that the rapid cross-linking had no significant effect on neuron shift after flap creation in porcelain cornea. Ectasia after LASIK extra, there is already a report from Germany that shows that after prophylactic cross-linking, there is ectasia occurred. This report illustrated that current use protocol is not effective. I'll skip the case because of the time. You can see the ectasia occurred. What about smile extra? After I reported my case, I have heard a lot of things that borderline cases could be done with smile extra. And this is an effective treatment. You just put some riboflavin in the pocket and then cross-link the case. Here is a study by, just another minute. Stage after smile exercises, was my trigger to do my presentation today. There is a reported case of bilateral ectasia after smile extra last month. And in this case, this was a preoperative topography and showed nothing in particular except a relatively thin cornea. And after the operation, it showed severe ectasia in the left eye and minimal ectasia in the right eye. And this means that this is not an effective procedure. The extra procedure are great, generally safe with few reported complications. Efficacy of the procedure is questionable because you have to wait for a long-term follow-up to make sure that ectasia will not happen. And more randomized studies with longer follow-ups, this crucial to weigh the long-term risks and benefits since the approach is not yet validated. Take-home message, extra procedure is not effective right now except after a long time follow-up, and you should wait for currently extra should be done only with great caution. Thank you for your time.